Good day, ma'am. I am Maple K.M. Mukamad, student nurse from Davao Doctors College. And for today's demonstration, I will perform the different types of parenteral administration. So, such as the intradermal, subcutaneous, and intramuscular. But first of all, let's define what is parenteral administration. So, parenteral administration is a common nursing procedure. This absorbs medication more quickly than the oral route. So, at the same time, it is a careful and accurate administration of medication. So, this is also promotes aseptic technique, which is a process or procedure used to achieve asepsis. So, this is to prevent the transfer of potentially pathogenic microorganisms. So, to a susceptible site that may result in the development of infection. So, the most used equipment for this is a syringe, which consists of three parts such as the tip that holds and connect with the needle, barrel, and plunger. So let's start with an intradermal medication administration. So this is one of the most common nursing procedure under the parenteral administration. So this is administered in dermis, just under the epidermis, and it is usually done in order for the nurses and doctors to know if a patient has a hypersensitivity reaction. So the tests done here are the allergic testing and a TB screening. Now that I am done explaining what is parenteral medication, let's proceed to the preparation of the intradermal. So first is to check the doctor's order, check the medication administration record or the mark. The rationale for this is the chart of the patient is more reliable than the medication ticket. So, after checking the doctor's order or the mark, check the label on the medication carefully against the mark to make sure that the correct medication is being prepared, so that the rationale for this is to ensure the correctness of the medicine. So, let's check the doctor's order. After that, check the label of the medication. Now that I am done checking the doctor's order, let's proceed to follow the 3 checks for administering medication. So, read the label on the medication when it is taken from the medication card. Second, before withdrawing the medication. And the third is after withdrawing the medication. So let's proceed to the next procedure. Next is to organize the equipment. The rationale for this is to save time and effort or the energy. So as you can see, I've already organized the equipment. So let's proceed to the preparing. So before start the procedure, perform hand hygiene and observe other appropriate infection prevention procedures. This is to gather the spread of microorganism or organized work. So, I'm going to sanitize my hand. So, after that, prepare the medication vial for drug withdrawal. So, this procedure mix the solution if necessary by rotating the vial between the palms of the hands, not by shaking. So, after that, remove the protected cup or clean the rubber cup of a previously open vial with an antiseptic wipe by rubbing in a circular motion. So, I'm going to remove the cup. Then after that, mix the solution, then not by shaking, just rotating between the palm of the hands. So, as you can see, I've already removed the cap of the vial. So, after that, rubbing the vial, clean the antiseptic wipe by rubbing a circular motion. So let's proceed to the next procedure. the next procedure is to withdraw the medication. So, attach a filter needle as agency practice dictates to draw up premixed liquid medication from multi-dose vial. So, this is the syringe that we need to use, and ensure that the needle is firmly attached to the syringe. So, I need to change it into the other. Again, ensure that the needle is firmly attached to the syringe. So, after that, remove the cap from the needle, then draw up into the syringe that the amount of air equal to the volume of the medication to be withdrawn. So, I will remove the cap of the needle. And then, carefully, so we need to draw up to the syringe the amount of air in it. So after that, carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle. So after that, inject the air into the vial, keeping the bevel of the needle above the surface of the medication. So this is the vial. So let's insert the. As you can see, the air is here, so let's insert to the vial. Remember, insert it into the right of the vial. So, after that, the rationale for this is the air will allow the medication to be drawn out easily because fluids move from an area of greater pressure to an area of lesser pressure. So, bevel is kept up the medication to avoid creating bubbles. So, withdraw the prescribed amount of medication using either of the following methods. The rationale for this is to encourage the client cooperation and reduces apprehension. So after that, the next procedure is to hold the vial down. So this is the vial. Then move the needle tip so that is below the fluid level and withdraw the medication. And after that, invert the vial to ensure the needle tip is below the fluid level and gradually withdraw the medication. The rationale for this is to the bevel is kept up the medication to avoid creating bubbles. So, the next procedure is to explain to the client that the medication will produce a small wheal, sometimes called a bleb. A wheal is a small raised area like a blister. So the client will feel a slight prick as the needle enters to her skin. So, good afternoon, ma'am. So may I know, ma'am, what is your name po? Okay. Age po? Okay, ma'am. So, thank you, ma'am. So this test, ma'am, is, unfortunately, ma'am, your doctor's order for a penicillin skin test, which means I will have to inject just a small amount of penicillin into your skin to check if you are allergic or not with the penicillin medication. Is that be alright, ma'am? Okay, ma'am. So, thank you, ma'am. So, the next procedure is to provide it for the client privacy. The rationale for this is to ensure the comfort and full cooperation of the patient. So since I've already closed the curtains or the window, also the door, let's proceed to the next procedure. So the next procedure is to select and cleanse the site. The rationale for this is to prevent entry of microorganisms into the tissue. So I will use the alcohol pad to cleanse the site. Next is to select a site. So this, the forearm about a hand's width above the wrist and 3 or 4 finger widths below. So avoid using sites that are tender, inflamed, or swollen, and those that have lesions. So apply gloves as indicated by agency policy. Cleanse the skin of the site using a firm circular motion. So as you can see, I've already cleaned the site in a circular motion. So starting at the center and widening the circle outward, allow the area to dry thoroughly. So prepare the syringe for the injection. So before that, remove the needle cap. So this, remove, and then while waiting for the antiseptic to dry, so the site is already dry, so expel any air bubbles from the syringe, and small bubbles that adhere to the plunger are of no consequence. The rationale for this is that a small amount of air will not harm tissue. So grasp the syringe into your dominant hands. So our right hand is our dominant hand. So close the hub or holding it between the thumb. So this is our thumb. So are the forefinger. Hold the needle also the parallel to the skin surface with the bevel of the needle up. The rationale for this is the possibility of the medication entering the subcutaneous tissue. So let's inject the fluid. So the non-dominant hand pull the skin of the site just like that at the site until it stops. For example, if you're using the ventral forearm and grasp the client dorsal forearm and gently pull it and tighten the ventral skin, and after that, insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. The rationale for this is the top skin allows for easier entry of the needle and less discomfort for the client or to our client. So, stabilize the syringe and needle and inject the medication carefully and slowly so that it produces a small wheal on the skin. So, the rationale for that procedure is to verify that the medication entered the dermis. So, ma'am, mag-inject na po ako ha. Ma'am, thank you. So after that, withdraw the needle quickly at the same time angle at which it was inserted. Activate the needle safety device. So after that, applies a bandage if indicated. Do not massage the area or the sides. The rationale for that is to minimize tissue damage. And then, so let's remove the needle. Then discard it. And after that, remove and discard gloves and perform hand hygiene so that this is to deter the spread of microorganisms. So, after that, after we perform the hand hygiene, the next is to circle the injection site with ink to observe for redness or induration or the hardening per agency policy. So let's draw the site. After that, document all relevant information, record the testing material given, and the time, dosage, route, and the rationale for that is to prevent medication error. So let's document. Then after that, evaluate the condition of the site 30 minutes depending on the test. As I observed, there is no redness or reaction that has been seen. So if there is a reaction, we need to measure the area of redness and induration in millimeters at the largest diameter and document the findings. So document if the client had a positive or negative skin test result. So follow agency protocol on labeling of allergies. So let's proceed to the parenteral drug administration subcutaneous injection. So first, the general preparation is to check the doctor's order. The rationale for this is to verify the client's or the patient medication is being ordered in the doctor's order sheet, or to check the MAR or the medication administration record. Let's proceed to the subcutaneous injection. So the next procedure is to perform hand hygiene and observe other appropriate infection prevention procedures or the clean gloves. The rationale for this is to deter the spread of microorganisms. So let's proceed to the procedure that we need to sanitize our hands. The next is to provide the client's privacy. The rationale for this is to eliminate embarrassment. So as you can see, I've already provided the privacy of our client. So let's proceed to the next procedure. Next procedure is to prepare the client. This is to secure that the patient is ready for the procedure. So this is prior to performing the procedure. Introduce yourself and verify the client's identity using agency protocol. The rationale for this is to verify that the client or the administration rather of medicine is being rendered to the right client. So good afternoon, ma'am. May I know what is your name po? Your age? Okay, thank you, ma'am. So next is to assist the client to a position in which the arm or the leg, the other abdomen rather, can be relaxed depending on the site that we need to be used. The rationale for this is to have a proper access to the site that is going to use in the parenteral drug administration. So, after that is to obtain assistance in holding an uncooperative client. So, ma'am, so let's assume that I've already positioned the patient in a supine position. I will assist you, ma'am, ha? Then I will show your abdomen po, ha? Thank you, ma'am. The rationale for that is to help the nurse to administer proper medication, also helps in distraction to lessen anxiety. Next procedure is to explain the purpose of the medication and how it will help using language that the client can understand and includes relevant information about effects of the medication. The rationale for this is to the right. It is the right of the patient to know what medication they are going to be receiving. So today, ma'am, I'll be doing subcutaneous insulin, and I will have to inject insulin in you in this part of your abdomen. Insulin, ma'am, is to control your blood sugar since you have a type 1 diabetes. So, will that be alright, ma'am? Okay, thank you, ma'am. So, after that, select and clean the site. The rationale for that is the friction aids in cleaning the skin. A clean area is contaminated when soil object is rubbed over its surface. So, select a site free of tenderness, hardness, swelling, scarring, itching, burning, or localized inflammation. Select. And after that, select a site that has not been used frequently. I will clean your abdomen and the site that we need to use. Okay, thank you, ma'am. Next procedure is to apply clean gloves. This is to protect from any forms of discharge coming from the client. So let's assume that I've already wear the clean gloves. So the next procedure is to as agent protocol indicates that clean the site with an antiseptic swab, start at the center of the site and clean in a widening circle to about 5 cm or 2 inches. So allow the area to dry thoroughly. So the rationale for that is to it helps to avoid hemolysis and to keep it uncontaminated. So after that, place and hold the swab between the third and fourth fingers, so this, of the non-dominant hand, or position the swab on the client's skin above the intended site. So the rationale for that is to have an easy access to prevent the blood, since there will be punctured skin after injecting the medication. So this. And after that, prepare the syringe for injection. So this is our syringe. Then, remove the needle cup. So, remove it. While waiting for the antiseptic to dry, pull the cap straight off to avoid contaminating the needle by the outside edge of the cap. The rationale for that is to avoid needle prick injuries. So, the next is to inject the medication. Using the non-dominant hand, pinch or scrub the skin at the site and insert the needle using the dominant hand and a firm steady push. The rationale for that is to this pulls the fatty tissue away from the muscle and make the injection easier. So, when the needle is inserted, move your non-dominant hand to the end of the plunger. Some nurses find it easier to move the non-dominant hand to the barrel of the syringe and the non-dominant hand to the end of the plunger. So, the rationale for that procedure is to have an efficient push to inject the medication. Then, inject the medication by holding the syringe, steady and pressing the plunger with a slow, even pressure. So, let's get this medication. Then, rationale for that is the rapid injection may cause discomfort. Pain the pain is minimized by inserting the needle without hesitation. So, let's insert the medication to the abdomen or the side of the patient. Then, after that, remove the needle remove the needle smoothly, pulling along the line of insertion while depressing the skin with your non-dominant hand. The rationale for that is to depressing skin places counter traction and minimizes patient's discomfort when the needle is withdrawn. Massaging the area may interfere with test result by spreading meds to subcutaneous tissue. So let's withdraw the then discard. And after that, if bleeding occurs, apply pressure to the side with dry sterile gauze until it stops. So, the rationale for that is to massaging the area may interfere with test result by spreading meds to subcutaneous tissue. Then let's proceed to the next procedure. So, the next procedure is to dispose of supplies appropriately. The rationale for that is proper receptacles are used to eliminate others to be pricked with the needle syringe. Let's proceed to the next procedure. So, assist the patient into a comfortable position. Flip down medication ticket if not using EMR, or the rationale for that is to promote patient comfort. So, Mom, are you okay with your position po? Okay, Mom. So, thank you. So, do aftercare. Remove the gloves. Dispose used items and in appropriate waste receptacles. So, return other equipment to perform hand hygiene. This is to prevent loss and deter the spread of microorganisms. So, let's assume that I will remove my gloves. And after that, perform hand hygiene. Again, this is to deter the spread of microorganisms. Then the next is to assess the effectiveness of the medication at the time it's expected to act. The rationale for that is to some may experience anaphylactic shock or some may have severe side effects. And after that, document all relevant information. The rationale for that is this is to secure record and enhances proper endorsement. Now I am done document all the information. Now let's proceed to the another parenteral medication, which is the intramuscular medication. So let's prepare the thing. So first is perform the hand hygiene and observe other appropriate infection prevention procedures. This is to deter the spread of microorganisms. So let's perform the hand hygiene. And after that, prepare the medication ampule for drug withdrawal. This is to, because the outside of a new needle is free of medication. So, this is our ampule. This. Then, flex the upper stem of the ampule several times with a fingernail. So, this. Then uses an ampule opener or place a piece of sterile gauze or alcohol wipe between your thumb and the ampule neck or around the ampule neck and break off the top by bending it toward to you to ensure that the ampule is broken away from yourself and away from the others. The rationale for that is the sterile gauze or the cotton ball protects fingers from the broken glass and the glass fragments. And then, places the antiseptic wipe pocket over the top of the ampule before breaking up the top. Then, after that, disposes of the top of the ampule in the sharps container. Okay. Then, after that, withdraw the medication. So, first is to places the ampule on a flat surface. So, and then attach the filter needle straw to the syringe. And then, after that, attaching the filter needle, remove the cup from the filter needle and insert the needle into the center of the ampule. Then, do not touch the rim of the ampule with the needle tip or shock. So, with a single dose ampule, holds the ampule slightly on its side if necessary to obtain more than the ordered amount of medication. Then, after that, getting the single dose of ampule, dispose of the filter needle by placing in a sharps container. So let's then, if giving an injection, replace the filter needle with a regular needle. So then, if giving an injection again, replace the filter needle with a regular needle, tighten the cup of the half of needle, and push solution into the needle to the prescribed amount. So, after that, check the mark. This is to, the chart of the patient is more reliable than the medication ticket. Then, the next is, then let's check the mark or the doctor's order. Then, after that, follow the 3 checks of administering medication. Read the label on the medication. First is when it is taken from the medication cart. Second, before withdrawing the medication. And the last is after withdrawing the medication. Then, the next procedure is to organize the equipment. This is to save time and effort or the energy. So, as you can see, I've already organized the equipment. Next is to perform hand hygiene and observe other appropriate infection prevention procedure. This is to prevent the spread of microorganisms. So let's proceed to our hand hygiene. And then, next is to prepare the medication from the ampule or vial for the drug withdrawal. This is the sterile items that are out of sight are in danger of being contaminated accidentally. Then, after that, provide the client privacy. This is to lessen patient anxiety. So, as you can see, I've already closed the window, also the curtains, and also the doors. So, the rationale, and the next is to prepare the client. So, the rationale for that is, this is to ensure that the right client receive the medication. Okay, ma'am. So, are you okay with your position, ma'am? Alright. Okay, ma'am. Thank you, ma'am. So, and after that, prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol. This is to gain cooperation or to gain the full cooperation of our patient. So, good afternoon, ma'am. May I know what is your name po? Okay, ma'am. Age po? Okay, thank you, ma'am. So, after that, assist the client to a supine, lateral, or prone or sitting position depending on the chosen site. If the target muscle is the gluteus medius or the ventrogluteal side, have the client in a supine position. Just like that, flex the knee. Yeah. Then, in the lateral position, flex the upper leg, and in the prone position, toe in. So, as you can see, my patient is already in a supine position and her leg is already flexed. So, the rationale for that is the appropriate positioning promotes relaxation of the target muscle. Let's proceed to the next procedure. So, the next procedure is to obtain assistance in holding an uncooperative client. And then, explain the purpose of the medication and how it will help using language that the client can understand, included the relevant information about effects of the medication. The rationale for that is information can facilitate acceptance of a compliance with the therapy. So, okay, ma'am. So, your doctor has prescribed you with morphine, Sopic abbreviate. Yes, so you're feeling of pain. Okay, ma'am. Okay, ma'am. Thank you, ma'am. So, let's proceed to the next procedure. So, select, locate, and cleanse the site. So, the rationale for that is, this is to reduce the discomfort of intramuscular injection. So, then after that, let's locate. So, ma'am, I will assist you, ma'am, ha? Okay, ma'am, thank you. And then, after that, select a site free of skin lesions, tenderness, swelling, hardness, or localized inflammation, and one that has not been used frequently. So next is to, if injections are to be frequent, alternate sites, avoid using the same site twice in a row. So the next procedure is to locate the exact site for the injection. The rationale for that is that the site where a skin appears to be healthy and free from irritation and inflammation reduces the discomfort of injection. So let's find that the site that we need to use. Okay, thank you, ma'am. So, after that, apply clean gloves. So, let's assume that we already wear the gloves. So, the next is to clean the side with antiseptic swab using a circular motion. So, let's clean the side. Then after that, transfer and hold the swab between the third and fourth fingers of your non-dominant hand in readiness for needle withdrawal, or position the swab on the client's skin above the intended site. The rationale for that is that this will help reduce the discomfort of the injection. So, and the next is to prepare the syringe for injection. So, also remove the needle. So, this is our syringe. Then after that, remove the needle cover and discard without contaminating the needle. So, let's remove the top. After that, inject the medication using the Z-track technique. So, it uses the ulnar side of the non-dominant hand to pull the skin approximately 2.5 cm or 1 inch to the side. Under some circumstances, such as for an emaciated client or an infant, the muscle may be pinched. So, the rationale for this is that the muscle makes it firmer and facilitates needle insertion. So, next, that is to holding the syringe between the thumb and the forefinger, as if holding a dart or pen. So, pierce the skin quickly and smoothly at the 90-degree angle. So, the rationale for that is to obtain all the medication while keeping the needle sterile and to ensure that insertion of needle into the muscle. So, after that procedure is to hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back on the plunger with your dominant hand. Aspirate for 5 to 10 seconds. So, the rationale for that is using a quick motion lessens the client discomfort. So, after that procedure, let's proceed to the next. So, if blood appears in the syringe, withdraw the needle and discard the syringe and prepare a new injection. If blood does not appear, inject the medication steadily and slowly, approximately at 10 seconds. So, while holding the syringe steady if using the ventrogluteal site. So, let's proceed to injection. So, mag-inject ko ha. So, after injection, wait 10 seconds if using the ventrogluteal site. Okay, so the rationale for that is to waiting permits the medication to disperse into the muscle tissue and also decreasing patient discomfort. And after that, withdraw the needle. So the rationale for that is to withdraw the needle smoothly at the same angle. Okay, so let's remove the needle. Okay, then cover it. Then after that, discard. Then after that, apply gently pressure at the site with a dry sponge. So the rationale for that is the use of an alcohol swab may cause pain or burning sensation. So if it is not necessary to massage the area at the site of injection, so the rationale for that is that massaging the site may cause leakage. So, let's apply the gentle pressure at the site with a dry sponge. Okay, then discard. So, if bleeding occurs, apply pressure with a dry sterile gauze until it stops. So, as we can see that there is no bleeding, or so we continue to insert the medication. So next is to activate the needle safely device or discard the uncapped needle and attach syringe into the proper receptacle. So as you can see, I've already discard the syringe that we used. Remove and discard gloves and perform hand hygiene. This is to deter the spread of microorganisms. So let's assume that I've already removed my gloves. So all I need is to perform hand hygiene. So let's perform the hand hygiene or our sanitation. So after that procedure, let's document all relevant information, the time of administration, drug name, dose, route, and the client's reaction. So this is for the future references. So let's document all the things, all the information. Okay, so let's proceed to the next. Assesses the effectiveness of the medication at the time it is expected to act. Now that we are done to demonstrate the parenteral medication, which is the intramuscular, intradermal, and the subcutaneous injection. Again, I am Maple K. M. Mukammad from BSN 2 of 12D of Group 35. Thank you.